Hey folks, when it comes to 12 lead interpretation, we've got a problem. And that problem is looking at ST segment elevation. My name is John Carrico. This is Pulse Education. Thanks for joining us again. So follow along with me here. So we have a patient. That patient's having chest pain or some other concerning symptoms that warrant a 12 lead. So we either order a 12 lead or we do a 12 lead ourselves. A 12 lead is acquired, and all of that is perfectly fine. Then the provider or the paramedic or the nurse, whomever, picks up the 12 lead, rips it off the machine, pulls it, starts to look at that 12 lead. And what I've seen time and time again is immediately they start scanning the 12 lead, looking for ST segment elevation. And folks, we've got to stop that. Now, you may be saying, whoa, John, what are you talking about? Not looking for ST segment elevation. That is how we help determine if a patient is possibly having a myocardial infarction, coronary artery occlusion. And I am not here to refute that. Clearly, ST segment elevation is one of the hallmark signs of a patient having an MI. However, it's how it's done, specifically in what order it's done. And if we, as I just described, immediately pick up a 12 lead and immediately start scanning for ST elevation, we are setting ourselves up for failure, and more importantly, potentially setting our patient up for failure. We may misdiagnose them, we may overdiagnose them, we may underdiagnose them. And that is because, again, what we have done is we have missed the steps that we're supposed to be taking when we actually pick up and interpret a 12 lead. So we have to take into account that there are a number of pathologies that can create ST segment elevation, or what appears to be ST segment elevation on a 12 lead. And so if we don't go through the right steps, if we skip steps in our interpretation process, then we're potentially going to misdiagnose our patients. Secondly, a 12 lead gives us a ton of information. It's almost like a little snapshot into sometimes the history of the patient, or certainly a snapshot into their current situation. And so if we go through and take a step-by-step approach to interpreting this 12 lead, one, we can gather some of that information, and that's going to help us in terms of assessing our patient and making the right diagnosis for them. So if you've ever taken a flight and you're getting on the plane and you're walking past the cockpit and you see the pilots in the cockpit, what are they always doing? Well, they're going through a series of checklists, and that is to make sure that each and every time they're doing the same thing so they don't miss a single thing. Obviously, pilots in terms of flying, they can't make mistakes, and they abide by a system of checklists. Well, essentially, with a 12 lead, we need to do the same thing. We need to abide by a checklist. Now, that's not to say that we're going to necessarily, every time we have a 12 lead, that we actually pull out a checklist and go through that. Although there's nothing wrong with that, but if we can keep very disciplined, if we can essentially stick to about 5 or 6 steps and do that same thing every single time we interpret a 12 lead, then we're going to find that, one, we're going to miss less things, we're going to actually be able to diagnose our patients better. And when we have 12 leads that are, for lack of a better word, are bizarre or are strange or are complicated, it is going to help us in terms of breaking down that 12 lead and interpreting it better. So just like the pilots who are going through their checklist, what I want to encourage all of us to do is go through those checklists as well. So there are a number of different methods that you can use for interpreting a 12 lead, and none of them are necessarily wrong, but I will say usually almost all of them, the part in which we're actually looking at ST segment changes is way down the list. There are a number of steps beforehand that almost everyone recommends doing prior to getting to the ST segment elevation part, and I think that there's a variety of reasons. One, so that we're correctly interpreting the information, and then also we're not missing any information. And then the other thing I think that happens, and I've seen this certainly with providers, is once we get to a point where we see ST segment elevation and that we're particularly worried that our patient is having a myocardial infarction, then suddenly our mind races into what do we need to do next? What else does the patient need? And we don't go backwards and look at all the information that we should have gathered prior to looking at ST elevation. So really important that we follow these steps. And so the steps I recommend, there's 6 steps that we're going to use when we interpret a 12 lead. And again, the first step is we're going to look at the rate and regularity of the rhythm of the overall strip. Then we're going to determine the axis, and that's going to give us a lot of information. From there, we're going to examine the different intervals. So the PR interval and the QRS duration and the QT, QTC interval. We're going to establish and look and see if there's any bundle branch blocks or any conduction issues. And then we're going to actually look to see if there's any ST changes. And notice I didn't see ST segment elevation, but we're going to look for both elevation and depression. And then after that, we're going to examine the T waves and then kind of anything else that we might need to throw in there after we've kind of gone through our initial checklist. So 6 steps that we're going to use. So our plan is, of videos, is we're going to break down each one of those steps to make it just a little bit more approachable, a little bit more applicable, and that way we can kind of examine each one of those steps. So I certainly hope you'll join us for the next video series of as we go through each one of those steps in detail. As always, this is Pulse Education. My name is John Carrico. If you like this video, please let us know. Please subscribe, leave us a comment below, and thanks for learning with us today.